If you're pregnant and you want to stay active, we're going to show you 5 things that you need to do to keep kicking butt before the baby comes.
Hi, I'm Justin, Doctor of Physical Therapy, and I'm here with Erica, who is also a Doctor of Physical Therapy and has specialized training in women's health physical therapy and is a mom herself and is an expecting mother. I can't think of anyone better suited to help pregnant women get their bodies into tip-top shape during their pregnancy.
Mobility and movement help support the changes that occur in the body during pregnancy. Although every pregnancy is different, these 5 exercises will help pregnant mamas move with ease. The first exercise I'm going to show you today is called a baby bump lift. This is a very simple exercise that focuses on breathing in and out and lifting your baby bump up and over your pelvis. So for this exercise, you're going to start with your feet about shoulder width apart with a slight bend in the knee. You're going to take a breath in, fill that belly up with air, and on the exhale, lift that baby bump up and over your pelvis. The goal of this exercise is to relieve pressure in your low back and to help engage your abdominals. So for our next exercise, we're going to take it down to the floor and sit with our legs crossed in front of us. You're going to sit up nice and tall and get comfortable and make your spine nice and long. You're going to bring your arm up over your head like this. Put your other arm at the side to give you a little bit of support. And you're going to lean over and feel a nice stretch through that side body here. With this also, you can take a couple of deep breaths in and out. And then make sure you always switch sides. And you could do a couple of these on each side, usually about like 3 to 5. So make that spine long before you bend over. A lot of times we just want to get right into that side bend, but you want to really grow tall first. Our next exercise is called hip 90-90. You're going to start by sitting on the ground here, and depending on the size of your bump, you're going to adjust your back. So for me, my bump is quite large, so I'm going to have to really lean back for this one to get some good hip mobility. So you're going to start with your hip at a 90-degree angle as well as your knees. And you're going to get nice and comfortable, and you're going to just let those knees drop from side to side. And you're going to feel a nice gentle stretch in your hip flexors, which will help get some movement into the low back. Make sure you do both sides symmetrically, and there's really no set count for these. You can do this for 10 reps, 20 reps, a minute or 2. And then you could come back to sitting. Our next exercise is called cat-cow. For this exercise, we're going to be starting on all 4s. So you're going to get into the quadruped position here, making sure that your spine is nice and straight in our starting position. We're also going to be using our breath a lot during this exercise, as we were in our previous exercises. So we'll start by arching our back up like a cat, and then dipping our back down and looking up. So you should feel a nice stretch here in the front of your belly. In this position here, you should try and bring your belly in towards your spine. I'm going to do this for you a couple of times, and then we'll start to add in some breath. So we're going to arch up, take a breath in, breathing out, and allowing that back to drop down. We should do this exercise about 20 times. But if you feel like you want to do more or less, that is fine too. And right from this exercise here, we could transition into our final exercise, which is called Wag the Tail. For this exercise, you're going to stay in quadruped. You're going to do a little bit of a side bend motion here. So you're really pretending like you have a tail attached. And you're just going side to side. This exercise is actually very relieving. It may look and feel a little silly, but it really opens up that side body really takes a lot of pressure off your back. And again, with this one too, we want to make sure we're breathing through. And we can do about 20 in each direction. Remember to always listen to your body and avoid any exercises that may cause pain or discomfort. Because every mom and every pregnancy is unique, it's important to consult your doctor before starting any new exercise program.
If you found this video helpful, please like the video and subscribe to our channel by clicking the button below. We're also going to put together a nice PDF that's going to outline step by step everything that Erica laid out for you today. Our sole purpose is to get you moving, keep you moving, so that you can live the life you love. Until next time.